Thank you. So we're just going to make it a very interactive session. And if you want to ask a question, you can either raise up your hand or you can put your questions in the chat box. Because we want it to be interactive, if you can raise your hand, that would be good. Because then you can ask your questions straight away. And between the two of us, we'll try our best to answer all questions.
And while we're waiting for the first question, I was just thinking maybe it might be worth sharing two pictures which shows the components of the vaccine that we're talking about. In the past, we have had a few questions from people who were wondering about what are the contents of the vaccine. So I'm going to show pictures of the contents of the Oxford vaccine and of the Pfizer vaccine, just to clarify what is in them. And if you like, you can take a screenshot of it or with your phone or however you want to do it. But that's just hopefully provides the answer to that question as to what is inside it. So I'm just going to try and do that, share the photo now. Right, so I presume somebody can you see my, are you able to see my?
Yes, we can.
Okay, sure. I'm just going to try and enlarge that. Sorry, my IT skill is nowhere near the ones that you're used to, so I'm just trying to work my way around this. Right. Is it gone?
Yeah.
Okay. Right. So that was supposed to show the contents of the Oxford AstraZeneca vaccine, and basically, you know, there's nothing suspicious here. Most of the components here are similar to what you'll find in other medications, including water. You can see the last thing listed is water. Sodium chloride is basically salt, table salt. Ethanol is alcohol, and some people may have concern about it, but actually it's only there in very, very tiny amounts. In fact, they've said that there's less of the ethanol in it than you will find in the bread that you buy from Tesco or from Lidl. So there's quite a bit of alcohol in the natural food that we consume, and there's much less alcohol in the vaccine than you will find it in naturally occurring food. So that wouldn't be anything that people should worry about particularly. Some people worry whether there is metal inside the vaccine. There is no metal inside the vaccine at all. And of course, there are no microchips inside the vaccine. And I'm just going to show again the slide for the Pfizer vaccine, hopefully, and then I'll hand back to Dr. Kuku. So this, coming up briefly, I hope, is the components of the Pfizer vaccine. Again, there's nothing very unusual here. I mean, for us as medical professionals, a lot of the medication that we get from, like the syrup we get for children and things like that, will contain many of these components. There's nothing very suspicious or like microchip or metal inside it. And there's nothing in it that will affect any, for instance, fertility or things like that. Thank you very much.
Thank you, Linus. That was very useful. So there's a question here. Please share the video for us later and kindly let me know. Okay, yeah. So there's a question about, would we be uploading it to the YouTube channel? Yes, we will. And I'll send the link for the YouTube channel to the pastor, and he can share it with the whole church. So that will be done. There's another question on there which says, is it true that the content comprises of human embryos?
Mm-hmm.
Do you want to take that, Linus? Hello?
Yes,
Okay.
yeah, hi. Sorry, I'm just trying to mute myself. Yeah, so none of the components that I showed are derived from human embryo. They are all manufactured in the lab and not from a human embryo remains or anything like that. And actually, you know, I think it would
Yeah.
human embryo or fetus is not something is not something that is readily available. It's not like water or coal or anything like that. I don't think there's any way to source things like that from human embryo. Not for a vaccine that we need to give everybody in the world. So I think there's nothing on that list that is from human embryo. I hope that helps.
Yeah. Thank you, Linus. Keep the questions coming. Thank you for asking the questions. The next one says, which lasts longer? Which lasts longer, immunity after contracting COVID-19 or protection from the vaccine? I'll answer that. So when we talk about immunity after contracting COVID-19, the evidence available says that people with past infection actually have about 83% protection for at least 5 months. But it does not stop you from actually passing the virus on to other people. So if you've had COVID-19, you have immunity, which is very short lasting. The evidence available doesn't tell us how long the protection from the vaccine is going to be. But it's very likely that the immunity from the vaccination will last longer than what you have from the infection itself. The reason being, what the vaccine does is we have 2 doses. So the evidence available tells us that when you get the first dose, 10 days after for Pfizer, you're about 52% covered. The efficacy is 52%. By day 14, the efficacy with Pfizer vaccine is about 90%. With the Oxford vaccine, it's said to be 72% initially, but by the time you get your second vaccine, it's about 90 to 95%. So the vaccination gives you the opportunity to get your body primed to develop an immune response and then to have a booster. So the second dose is like a booster, which gives you longer lasting immunity. So the evidence is not out there yet because, like we all know, this is new and where the government is gathering and the researchers are gathering the evidence. So later on, we'll have factual evidence. But for now, I will say vaccination is highly desired. The reason why vaccination is highly desired also is the fact that the vaccination not only prevents you from getting the deadly version of COVID-19, it also prevents you from spreading it to others who may be very, very unwell if they get it. The other thing it does is it prevents you from getting the complications. So people with COVID-19 face different challenges. You have several groups. You have one group that will get the infection and they get better. In fact, you have one group that get the infection and don't know they have it. So they're asymptomatic carriers. You have the other group that gets it and they have a mild illness and they get better. Then you have the other group who get it, get better, but have the long-standing effects, which we call long COVID. So after 12 weeks, they're still struggling. And then we have the most worrisome one, are the ones who get the illness and then actually die from it. So this is why the vaccine has been made, is to prevent the complications and the spreading of the vaccine so that we can all come out of this pandemic. I'm sure every one of us in one form or the other has been affected by it. Even if you haven't got the infection, I'm sure you would have a relative, a friend, a loved one who's had it. So I hope that answers your question. Linus, do you
Thank
have
you, Dr.
anything to
Dayo.
add?
Yes, hi. Thank you, Dr. Dayo. And praise that asks a second question. Is it safe to get vaccinated even with underlying medical conditions? The answer to that question is yes, it is safe. And in fact, what we know from this illness is that it tends to affect people who have other medical conditions more. So if people that have a serious medical condition tend to suffer more from the illness, they're also unfortunately more likely to suffer complications and even death, unfortunately, in some circumstances. So the medication, the vaccine was tested in these individuals. So when they tested the vaccine at the trial stage, it was tested on people who have other underlying medical conditions, and it was found to be safe and effective in them as well. So absolutely, yes, because you have an underlying medical condition, and we're talking about things like hypertension, diabetes, COPD, sickle cell disease, and all other medical conditions, it is absolutely safe, and it's advisable that you still get the vaccine because it works, but also because it protects you from having those complications, as Dr. Dayo was explaining a short while ago. Thank you very much.
Thank you, Linus. I'll take the next question. It says, good morning. As of now, what's the worst reaction a person of color has had after receiving the vaccine? So with every vaccine, and actually with every medication, there's always that risk of side effects. The evidence available shows that you could get side effects, but these side effects are reversible and very temporary. So the common side effects are you could get soreness and maybe redness or even a bit of swelling at the site of the injection, which is usually given in the arm. For some people, you get fatigue, tiredness. For some people, you get headache. For some people, you get fever. So I got my vaccine probably about 2 weeks ago, my first dose. And the side effect I got was a headache and tiredness. And that lasted 24 hours. I could still do what I wanted to do, but you know, I noticed the difference. Just took some rest, took some paracetamol, and drank a lot of water, and I got better. So yes, there is the risk of side effects, but the question is, would you rather have the side effects or the effects of the illness itself? So there are side effects, but these side effects are reversible. They are very temporary, and it's not life-threatening or not life-debilitating. Linus, do you have anything else to add to that?
I think, yeah, I completely agree with that. So both Dr. Dayo and myself have had the vaccines. I had the Pfizer vaccine and Dr. Dayo had the Oxford. So we are also talking from experience. It's not just theory that we're talking about. I had a mild sore arm for a day or a day and a half afterwards. Again, compared to the risk of actually getting the illness and the risks to my family and to people around me, I think it's more than worth the side effects. And to I think there was a question specifically talking about people of color. There is no evidence that people of color react differently to the vaccine than everyone else. So people across different races had similar, usually mild side effects. They don't last more than a few days, usually. And I think there's also a related question that people often ask, was the vaccine tested on Black people? And the answer to that is yes. And I can share a picture of that if it's helpful, just to show you that it was tested on Black people before it was approved. So this is I'm just going to share the picture for the Pfizer vaccine first, just to show that it was tested in Black people. Right, so this is the data for from the Oxford vaccine trial. And if you have a look at it, you can see this table describes the different ethnicities that were involved in the trial. And you can see where there is a red underline that African and African American people were tested. And if you look at the last column, you can see that it shows that actually it was also effective in Black people, just like everyone else. In fact, if you look at the numbers critically, for Black people, it was 100% efficacy, which is even slightly better than everyone else. So yes, it was tested, and yes, it works. And no, there's no reason to think that it has a different side effect profile in Black people compared to other races. If I just take the next question, which I think is about, so I'm just trying to pull
So
up the
the
next
next
question.
one, I'll read it out to you, Linus. The
Yeah,
next one
okay.
says, does it mean taking I guess you meant vaccine, the vaccine, does it mean taking the vaccine means that you can't contract the virus?
Okay, so that's an interesting question, and the reason is that the results that we have, the test that has been done, did not look to address that question. What they were checking is to see if the vaccine prevents severe illness, like going to hospital or going to intensive care support. And clearly they found that it prevents those. So because they didn't look to see if it actually prevents getting the virus per se, there's no answer to that question yet. However, as we're speaking, Pelumi, they are actually collecting the information on that particular question to try and answer the question whether it stops people from getting the virus completely or not. I hope that helps.
Thank you, Linus. I'll also add to that that taking the vaccination doesn't mean you cannot get the virus, because the vaccination is 95%. So it protects 95%. That means there is a little 5% that may get the infection. But if you get the infection, it's not going to be as bad as if you didn't get the vaccine. So if you weigh up the risk and the benefit, the question is, do you want to expose yourself to the risk of the infection, which could end you up in hospital in ITU, or could even lead to death? Or do you want to take the vaccine, which primes your body? So what the vaccine does is, the vaccine is almost like getting an army ready to fight. So the vaccination primes your body, gets your immune system ready for, if you get the infection, then it fights it and eliminates the virus. So if you don't get the vaccine, your body will try and fight it. But can you imagine trying to fight without weapons, or trying to fight as an army fully loaded with weapons to fight that battle? So I hope that's a good analogy to help us understand that even though our body can fight the vaccination, you're better off having a trained system to fight the infection rather than waiting for your body to fight without any ammunition. So 5%, the vaccine is 95% coverage. So there is that little 5% that could get the infection.
Thank you very much. The next two questions are fairly quick answers. So Ayomide asked, do you have a choice of which one to take after having COVID-19? There is no choice. People aren't offered choices as to which one to take, because actually the vaccines are in short supply globally. You will have heard in the news about all the politics and fights going on about getting the vaccine. So if at all they have one, and I think we've been privileged in this country that we have access to them, people are generally not given a choice of which one to take. We would encourage people to take whichever one is available when you get invited to take them. And the second question is about, how do you report a side effect from the vaccine? That's from Praise Dada. And when you get the vaccine, they actually give you a leaflet before you leave the vaccination center. They give you a leaflet which contains information about telephone number and internet address where you can report the side effects. And Dayo, I don't know whether I want to add a few things to that.
Yes. I'll also thanks, Linus. I'll also like to add on that if you have a history of allergy, so if you know that you have a history of atopy allergy, discuss it with your GP, discuss it with your doctor, discuss it with your GP practice, because it has been said that people that have history of bad allergy should probably have the Oxford vaccine rather than the Pfizer. So if you know you have had allergic reaction in the past, or you've had anaphylaxis before, make sure you let whoever is offering you the vaccination know.
Right. There's a question, an interesting question from Yeti. Yeti is asking.
Yeah. It says it has been observed in the US that some vaccinations are not appropriate for over 65. This was only recently noticed. How are we sure that all needful experiments have been evaluated without gaps? That's quite an interesting question. In the UK, we have two vaccines being offered. So we have the Pfizer vaccine and we have the Oxford vaccine. The Pfizer vaccine is the mRNA and the Oxford vaccine is the one by the AstraZeneca. Both of them have been proven and tested. They have been tested in people over 65. In America, they have an extra one, which is the Moderna, but we're not offering that in the UK now. So the two vaccines that are available in the UK have been tested in over 65. I think Linus has some data to confirm that. Do you?
Yes, I do. And I'm just going to show you, it's the same one that I've showed you before, showing different ethnicities. I can also show you the same slide, and it shows the different age groups that we have tested for the Pfizer vaccine. Let me just see if I can pull that up. I might need to.
So I think what we need to be mindful of is the due diligence has been done with regards to testing out the vaccines, and the MHRH has authorized it, which is the regulatory body, the Medicines Health Regulatory agency have approved it, and also the Joint Committee of Vaccination and Immunizations. So we are very careful in this country, and it goes through safety checks and efficacy checks and all the necessary checks before we offer it to people.
Yeah, so if you look at this slide, which I shared earlier, remember we were looking at the red underline, which showed that Blacks and African Americans were included in the trial. If you look above it, you'll also find the different age groups that were included in the trial. And you'll find that the over 65s and the over 75s were included. And if you look at the last column, which shows the efficacy in those subgroups, you will see that it was still found to be, efficacy means how well the vaccine is working, by the way, sorry to use that slang. It shows that the vaccine was still working in this age group. So I'll be interested to sort of know exactly where the information about the lack of efficacy is coming from, because it will be useful for me to understand what it's based on. But from the information I have, which is what I'm sharing, the data from the actual experiments that it did, it shows that that it was effective across age groups. I have similar data for Oxford vaccine, but that one is slightly more complicated. Let me just see if I can pull it up if it's useful. I'm not sure actually if it includes the, okay. So this is the data for the Oxford vaccine. Unfortunately, my screenshot does not include the different age groups in this particular screenshot. But you can see that Blacks were included in the test. Again, the red underline shows that Black people were tested, and it was found to be effective in Black people as well. So I hope that answers the question that was raised.
Thank you, Linus. The next question says, when you take the vaccine, how long will the antibody last in your body to help you fight the virus? The answer to that is we do not know. It is work in progress. So because information is being gathered as people get the vaccine, so further down the line, we'll be able to answer that. But for now, I don't think anyone can tell us how long it will last.
Yes, and just to add to that, when we say we don't know, it's not that that can come across differently to different people. It doesn't mean that we know that it works. It's just that because they've only been testing this vaccine since summer last year. So there's only been so many months since it was since they began the testing. So anybody telling you what will happen in the future is just bluffing. Only God knows the future. So, you know, if somebody was to give you an answer to that, they're just bluffing. The fact is that we don't know. That just reflects the fact that we haven't had enough time to find out the answer to that question. I think there's a comment.
Thank you for clarifying that.
There's a comment from Olatunji, who's saying that the side effects, I think, is mostly headache, and it's advised to take paracetamol after the vaccine. Yes, that's absolutely correct. For the sore arm and the pain and discomfort and headaches, you can take paracetamol, and that should hopefully make it a lot easier for you.
So the next question says, thank you for that, says, can you take the vaccine if you have a low amount of white blood cells? So what this signifies is if you have a low amount of white blood cells, there is a very high chance that you are immunosuppressed, but it has been found that it has been recommended that you should have the vaccine. The only caveat is that it may take you longer to build immunity, but that doesn't stop you from taking the vaccine. So people on immunosuppressants, people with low white blood cells, people on steroids, people on things like methotrexate, it has been recommended that they actually take the vaccine because the benefit outweighs the risk. And in everything we do, what we do is we weigh up the benefits and the risk. If the benefit is more than the risk, then you have it. If the risk is more than the benefit, then you don't. But evidence shows that the benefit is more than the risk. So yes, you can have the vaccine if you have low white blood cells. Discuss it with your GP. And remember, what we're saying today, whatever we say today, I need to say, please wait to be invited. Do not go off to your GP surgery ringing up for your vaccination because the government has a protocol in place. So what we're doing is sort of preparing us for when that invitation comes. And that person with the low white blood cell will be invited by the surgery, by the GP surgery, and they are already aware of your medical records.
Thank you very much, Dayo. I think I completely agree with that. And, you know, it's better to have some defenses rather than having no defenses. That's the way I would look at it. There's a question that we may have missed from Yeti, which Yeti was asking, with the mutations in the virus itself, is it worth waiting just in case they get a new vaccine that will cover the new strains? I think that's my understanding of that question. And it's an interesting question. And I think the answer to that is, you know, what I would call the sort of common sense answer to that is that number one, we know now that the vaccines that we have are to some extent still effective against the new strains of the virus that has been found. So you will still get some protection. It may not be as much as the one that we had previously, but you will still get some protection against the new strains from the information that we have at the moment. So it's better to have some protection than to have no protection against this horrible illness. We're also lucky to live in a country where healthcare is free. So even if they were to find better vaccines in the future, it's not as if we're going to spend more money to get those newer ones. We could still get invited to have the newer vaccines that may be better. The other thing is that, you know, for some of the new strains, they're not spreading as fast as you know, the other strains. So the new strain in the UK is spreading a lot faster, but the new strains in other parts of the world is not spreading that much faster than the old virus. So some of the new strains may never get to the UK. Hopefully, we pray that they don't get to the UK. So overall, it's better to have the vaccine that we have on the table at the moment because you get protection now and you get some protection against new strains rather than waiting for a future which is uncertain.
Thank you, Linus. So what the evidence also shows is that the new strain, so there's something we call cross immunity. So the vaccines we know are effective against the previous strain. What evidence shows is that the vaccines cover 99%. So there's just 1% chance that it would not cover the new strain. But because there's cross immunity, you will still be covered against the new strains. And the new strains that have been found, which we have the strain from Southeast in the UK, and the one there's some from South Africa, there's some from Brazil. Talking about the one in the UK, what has been found is that the new strain is sort of spreads. It sort of, the evidence shows that it affects mainly the children, the age 20 and under, and it spreads quicker, but they are asymptomatic. They don't have symptoms. So the recommendation is that we should still have this vaccine because the vaccine covers even the new strain. There is a 1% chance that it would not cover. So it covers 99%. I don't think there's anything 100% anyway. So that should encourage us to take it. The other thing is that research is still going on. So if it becomes worse, they can always get some vaccines or some booster to actually give or offer to cover whatever comes out. So for what we have now, like Linus said, we are very fortunate in this country that it is free. And if it is free and offered, then we should take it. Some protection is better than no protection.
Thank you very much, Dayo. I love that there's quite a few questions. So we're going to try and move along a little bit faster. So there's a question, can I ask my GP to come in and get the vaccine? I'm trying to understand this question from Pelumi. If you mean if the GP would do a home visit to give you the vaccine, the answer to that question is if you are housebound or you have a family member who is housebound, then the answer is yes. When it gets to their turn, and that should be hopefully soon, there will be a team, not necessarily your GP, but a team from the health service that we should call in to offer the vaccine to them if they are housebound. For those who are not housebound, they will get an invitation, a letter, to come to a vaccination center near them to have the vaccine. And the second question, there's a question from Praise that they're asking, do you still need to wear a mask and avoid close contact with others if you have had 2 doses of the vaccine? The answer is yes. And the reason is that, like Dr. Dayo was saying, it's 95%, which is really good, but actually there's still that 5%. The other thing is that it takes time between the time you have the jab and the time the body fully develops a protection to the virus. And one last reason is that we don't know how well it stops people from transmitting the virus. So although you're protected, we don't know if we will stop you from giving it to someone else. And you don't really want to be the one giving it to people. So in summary, even if you've had the vaccine, even if you've had the 2 doses, the advice is that we still carry on with the precautions, staying at home unless there's an absolute essential reason to leave the house. And when you leave the house, hands, face, and space. Thank you.
Thank you, Linus. The next question says, has the vaccine been trialed in under 18? Will children be able to take the vaccine? So in the UK, the vaccine is offered to people over 18, but I am aware that in the United States of America, they have actually tried the vaccine. They give the vaccine to children between age 12 and 18. But in the UK, the vaccine is not being offered to children below to children at this point in time. The vaccine is offered to everyone 18 and above, according to the criteria that has been authorized by the Joint Committee of Vaccinations and Immunizations. So for now, in the UK, the children are not being offered the vaccine. If you have any concerns, I will say discuss it with your GP, and your GP then can update you on that.
Yeah, thank you very much, Dayo. So, if I just take a literal lens to the question that Demi was asking, the Pfizer vaccine included people that were 16 and above. So yes, it was trialed, but like Dayo was saying, in the UK, it's offered for a certain age group. And as we speak, the trials are being extended to children. So they're trying to look at the data on how children will respond to the vaccine. So hopefully in the future, as time goes on, we'll have more information out about children. There's a question, is the vaccine going to be taken yearly like the general flu vaccine? That's from Omolola. Thank you very much, Omolola. It's like some of the other questions we've had today, which we cannot answer because the future is unknown to us. Only God knows the future. And we hope that God will protect us from the virus in the future. But we don't really know if it's going to be yearly. It's possible, but nobody knows for sure. We'll have to wait and see how the pandemic pans out.
So the next question says, can you take the vaccine if you already had COVID, and how long after you got COVID? So I'll answer that by saying, if you've got COVID, the recommendation is that due to the severe health risk, you should still take the vaccination because you could still be reinfected. And remember, I said the antibodies from the past infection will usually provide at least just about 83% for about 5 months. So the recommendation is that please still take the vaccine. So the second question, it says, how long after you've had COVID? The recommendation now is that if you've had COVID-19, you wait for 28 days, preferably. If you're unwell, you shouldn't. So if you have a temperature and you're unwell, you should avoid taking the vaccine at that point in time. If you're COVID-19 positive, then wait for 28 days after your results or after your symptoms before you get the vaccine.
Thank you very much,
And
Dayo.
if you've had a flu jab, you need to wait for at least 7 days before you have the COVID-19 vaccination.
Yeah, there's a question from Yeti asking if you had the virus. I think Yeti is referring to long COVID. If you still have residual effects in your system, what dangers do that pose to your household members exposed to it that never had a virus and not yet had the vaccine? I think that if you no longer have active symptoms like fever, then people with long COVID are not necessarily infectious. That is, they don't spread the infection to other people. The symptoms they have from long COVID is because of the impact the virus has had on their body. It doesn't necessarily mean that they are able to pass on the virus to other people. And in terms of the household, so because if it's long COVID that somebody is suffering from, I don't think there's no need for them to sort of isolate from other members of their household. But of course, the advice still is there that as households or bubbles, that we should all stay at home and only leave the house when it's absolutely essential. And even then, taking precautions as we do that. I hope that helps, Yeti.
So the next question from David says, how come the vaccines were trialed and approved within such a short period of time, but other clinical trials take a longer amount of time to be approved? That's a very important question. The answer to that is, I'll start by saying they haven't cut corners. What has happened is they sort of cut the red tape. So what do I mean by that? In the past, before the vaccine is approved, you have to go through a lot of hoops. You have to go through, there was sort of a bit of bureaucratic steps in there. So what will take a year this time, because of the seriousness of the pandemic and the effect on lives, money has been pumped into it. So it's been extra funding given towards the vaccine. That's one bit. The other bit is, like I said, the red tape was cut. So processes were approved quicker rather than going through 10 steps. They cut it back to like, so in the past, if you want to approve a vaccine, you have to wait for maybe so many months, and they cut all that back. So they fast-tracked it. But the process wasn't cut back. The other thing is, in the past, you used to have to wait for people to volunteer to join the trials. But because of the seriousness of this pandemic, people have readily put themselves off to be involved in the trial. So that has increased the pace at which the research has gone on. And that's why this time around, we've had a quick result. And it's not only with vaccines, you find out with even so many things, IT, so many things. There's a lot of fast tracking thing because of the seriousness of this pandemic. So I'd like to reassure us that there hasn't been any reduction in the safety measures or in checking out the efficacy, which is, as Linus said, how well does the vaccine work? Those have not been compromised in any way. What has happened is more funding has gone into it. People have come forth quicker than before. And so based on that, we've been able to have our vaccines very quickly.
Thank you very much, Dr. Dayo. There's a question from Demi asking, for those that are yet to have children, will taking the vaccine impact fertility? The answer to that is no. The information we have, there's no suggestion at all that it will have an impact on fertility. And in fact, there's an association of doctors in the UK, women doctors, fertility doctors in the UK, and they've brought out a statement saying that they, advising that it has no effect on fertility. Our understanding of how the vaccines work is such that there's no reason to believe or to even suspect that it will have an effect on fertility. So again, women can be very confident that it wouldn't have an impact on their fertility. I hope that helps, Dami, but you can ask more questions or raise your hand if necessary.
I think that's the last question.
Okay.
Excellent. I'd like to say a big thank you to everyone. The engagement has been very encouraging. Thank you for asking your questions. Thank you for trusting us to come along and giving us the opportunity to actually answer those questions. If you have any more questions, I'll ask you to forward it to your pastor, who can then forward it to either of us. The other way to find out will be, I've got an Instagram page, which is Healing G Zone. So it's Healing G Zone on Instagram at Healing G Zone. If you go on my Instagram page, you can ask me your questions and I will answer them. This recording will go up on YouTube, and like we said, we'll put the link out to Pastor so he can share it with you all.
Yeah, thank you very much. And thank you I want to join Dr. Dayo in thanking your congregation for having us today. I feel blessed to be amongst friends and our community, as Black people, but also as Christians. And I hope that you have found this session useful. It's important to say that it's absolutely normal and okay to have questions. What we do advise, like Dr. Dayo was saying, is that if you have those questions, that you try and find the answers from reliable sources. And in addition to the sources that she's mentioned, you can also look on the NHS website, where you will find quite a bit of information on the vaccine. So thank you very much, and God bless you.
Thank you. There's one more question which says, are you willing to come back when needed?
Yeah, I think, well, I can speak to myself, and I'm sure and Dr. Dayo as well, that it depends. We can always be flexible about time, as long as it doesn't clash with our other commitments or work. We will be happy to do that. And just to speak a bit more on that, because the reason why we're doing this is not part of my job or Dayo's job, because we feel challenged by the impact that COVID has had on our community as Black people. Our people have suffered a lot more than any other community from this horrible illness. It has had a much more devastating impact on our community. And we find ourselves in a position of privilege, thank God, that we are in a position to know what is going on. And that's why we want to share the information and hopefully encourage our people to engage with the vaccination. We're also lucky as God's children that He has given scientists knowledge to discover these vaccines and develop them as a way of ending this, hopefully, this horrible illness and the impact it has had on our families and communities. So thank you very much.
Thank you very much. Thank you, thank you, thank you. And the God of all peace keep us all, even as the blood of Jesus covers us and keeps us from every form, every form of illness in the name of Jesus. So thank you, thank you, thank you.
Praise the Lord. Thank you so much. Thank you. Thank you for your time. Thank you. Thank you. And as we've asked you, we know you are willing to even attend to us whenever we need you. We are